Hello everybody, this is Manish Kumar and you are watching OP Talks. In our latest episode, we are going to discuss the different facets of COVID-19 vaccination. Are they really safe? What are the associated risks? Should you go for that? These are some of the basic questions that people now want to know. We are today joined by Dr. Swayam Pragyan Parida from the All India Institute of Medical Sciences. We will try to get answers on most of our concerns, queries from the expert. Dr. Parida, welcome to Orissapost Live on this special conversation on COVID-19. Dr. Parida, how exactly a vaccine works in a human being and how it ensures that the vaccinated person is safeguarded from a disease?
Since basically creates immune response, so it helps a human body to mount one immune response towards a particular pathogen or disease causing agent. So again, is it the only vaccines which produce immune response? So we should be going to a little earlier. Not only vaccines cause immune response, but also the natural infection also cause immune response. So how it happens? Whenever the pathogen or the disease-causing organism, it enters the body, it is taken up by specialized cells of our body, like white blood cells are present in our body, WBC we call. They take up the antigen or the pathogen or the disease-causing agent, tries to kill it, and it prepares some of the fragments. Now these fragments are produced to our immune system, and immune system mounts one immune response. So immune response can be produced both by the natural infection and also by the vaccines. Now this is the vaccines basically is given to protect you from a disease, meaning you will not suffer from the illness or sickness or any morbidity or mortality, but you will fight against the disease. Simply, if you say the vaccines are a simpler part of the pathogen or disease-causing agent, which when introduced to the body, it never causes disease but creates immune response.
Why you think people should go for this COVID-19 vaccination? Why it is important during the pandemic to get vaccination against the virus?
Yes, coronavirus is a novel virus, a new virus. Entire thing is not yet known how it transmits. I mean, it is known, but not further studies is available. That is why we need to protect ourselves. Now, second thing is, so much of morbidity illness is happening. So many deaths have happened. Recently, mutations have been happening. I mean, it is a continuous process or ongoing process. That is why we need to protect ourselves. One more thing, the persons with comorbid conditions are basically getting affected. Basically, deaths are happening in those cases also. And as you see, comorbidity is happening to a normal person. I mean, every human being, most of them are having diabetes, most of their family members are having hypertension, some are having asthma. These are so common. Cardiac diseases are happening, kidney problems are happening. So we cannot lose our mankind, because of this coronavirus. That is why a vaccine is required.
Dr. Parida, there are some concerns among people relating to the safety of the COVID-19 vaccinations because it has been prepared within a very short duration of time. So how you respond to these concerns when there are allegations, when there are concerns that the vaccinations have been produced within a very short period of time?
Manufactured within a short period of time because the phases of development is kind of simultaneous. So we have like phase 1, phase 2, phase 3 trials, and before that we prepare attenuate the virus and the processes there. Now these are the processes like a simultaneous or parallel affair. That is why the time is reduced here. We see a reduced time period, but the quality control is really strict. The same process has been maintained. Only thing is phase 1, phase 2, phase 3, we see somehow a little bit of parallel and there is no gap as such. Otherwise, the routine process takes a little bit of gap. They give gaps and they do it. But at this point of time, because of a sudden drastic situation, parallelly investigations are being done. That is why time seems less here.
And there
Else,
is certain
everything
groups of
is same.
yeah, there are a lot of anti-vaccine advocates in Odisha also, in India also, and even outside, more in outside countries. So they say that there are a lot of side effects have been reported from different kinds of vaccines. So how you report to that? How you respond to that?
We can say allergy or any adverse event happens can happen to any of the thing which is outside our body. Maybe a food item, maybe a drug, maybe a vaccine, maybe one anesthetic agent. It can happen from anything. So similarly here also there is a chance. Of course there is a chance, but if we see the Covaxin or Covishield or the other the vaccines, the chance is quite less and it is within the normal limits.
According to the data given by the central government as well as the state government, some section of population develop adverse reaction after getting vaccinated. So why these human beings get adverse reaction post vaccination? What is the science behind them?
For example, if we give DPT injection in case of children, we expect 20 to 50% of children given vaccine will develop some of the symptoms. Okay, so it depends upon various factors, particularly the vaccine inherent constituents of the vaccine. Some constituents are available, so these constituents can cause some of the reaction to different people. The point here is that vaccine constituents can act differently in different people. Okay, and then second thing is some people's genetic makeup are different. I mean, from one person to another person, it is also different. So genetic makeup is also different, and then psychological makeup is also different. Now, some people develop anxiety, dizziness. This is basically also an anxiety related or psychological related. So we can say number one is vaccine constituents can act differently in different people person, and the genetic makeup of the person is somehow responsible. And third is also psychological factor or the fear factor is also different at different level. So this is the main reason. I mean, these are the main reasons for the different level of reaction in different people.
Ma'am, you were handling one of the vaccination centers in Odisha at AIIMS Bhubaneswar. So what kind of insights you have, what kind of experience you have seen till now, how the people who have come to take the vaccination react? Are they comfortable with the whole procedure, or some people are little bit hesitant while taking the shots?
Naturally, we have seen two groups basically. One group is a bit apprehensive and one group is normal. They are willing to take the vaccine, and one group is a bit apprehensive regarding the side effects. Basically, they are worried about the side effects. They usually ask, I mean, have you taken the vaccine? Anything happened to you? I mean, these are the kind of questions they ask. So to the people who are afraid of the vaccine, we usually give counseling. No, this is very mild reactions happen. It may not happen at all. This may, I mean, we have given around 500 plus number of beneficiaries. Only 10 people have suffered reported like mild headache and then joint pain and then the myalgia. So the number is quite less, we tell them.
Ma'am, there have been reports of deaths of people after getting vaccination. Not in Odisha, but in some states, there have been reports of people dying after getting the COVID-19 vaccinations. So their families have alleged that the comorbidities and were not reported before getting vaccinations at the vaccination centers. So I want to know from you, because you work in a vaccination center for COVID-19, I wanted to know from you that what is the whole procedure? Do the vaccination centers record the comorbidities and other health conditions before giving vaccination? What the norms say?
Yes, the comorbidities they ask, for example, do you have any comorbidities, and what are they? Are you taking any medication? For how long you are taking any medication? Have you ever suffered from COVID-19? I mean, COVID. Were you COVID positive? How many days back? So kind of thing. And then, are you taking any cancer therapy or chemotherapy to ascertain whether the person is immunocompromised or not, or whether the lady is pregnant or not, whether the lady is lactating or not. All these questions are basically asked. Then after the questions are ticked like yes or no, on that basis we assess whether the person is fit for vaccination or not. And after that, supposedly a person is fit for vaccine, he will go to the other counter where there is CoWIN app, personal with CoWIN app. Now, in the CoWIN app, the person's details are entered, meaning the person has come for the vaccination, and the ID proof is verified. After that, the person goes to the vaccination center where vaccine is being given. Okay. So before giving vaccine, also question is asked like, are you normal today? Are you not feeling any illness or any disease? I mean, is there any acute disease like severe gastroenteritis, severe respiratory tract infection, or high rise of temperature? All these things are present or not at that point of time. If these are present, also we say they come after a few days. I mean, 2-3 days after they become normal. Regarding serious illnesses or serious allergic reactions, which will be managed then and there, because within 30 minutes it will be known. Okay, so there is no life-threatening illness after 30 minutes as such. Therefore, in a center, when they come for vaccine, there is no, when we observe them for 30 minutes, we rule out all life-threatening illnesses. After 30 minutes, whichever will be there, that will be only milder variety, which can be managed. There is no need to be afraid.
Thank you, Dr. Parida, for taking part on this special conversation with Orissapost Live.
Welcome.
We hope that by the end of this interview, our viewers must be having a good idea on the vaccine. This is all for today. Meet you next time on Orissa Post Live. Thanks for watching.